When it comes to hypertension, specialists are looking for something different. Hypertension is one of the leading risk factors for mortality across the globe and is responsible for 9.4 million deaths worldwide every year. It accounts for approximately 50% of all deaths from stroke and heart disease. Beta blockers are antihypertensive agents that can intervene at many points in the cardiovascular continuum. There are two types of receptors, beta 1 and beta 2, that are to be considered when dealing with beta blockers. The implication is that a beta 2 blockade would be potentially harmful. Beta 1 selectivity is important in the treatment of hypertension. Beta 1 selective beta blockers are considered cardioselective, as cardiac tissue contains predominantly beta 1 receptors. They tend to have fewer adverse effects associated with beta 2 blockade in the lung and peripheral tissues. We call bisoprolol the different beta blocker because despite coming from the same origin, not all beta blockers offer the same value. Bisoprolol is different from other agents in its class, including atenolol, metoprolol, nebivolol, and carvedilol in terms of beta 1 selectivity, efficacy, and safety. Bisoprolol is different in beta 1 selectivity. Bisoprolol is a third-generation beta blocker with a remarkably high beta 1 selectivity and has approximately 20-fold greater selectivity for beta 1 than beta 2 receptors. In a study by Mack et al. 2001, bisoprolol was shown to be 5 times more cardioselective than nebivolol. Bisoprolol is different in efficacy. Bisoprolol shows greater reduction in mean 24 hours blood pressure control than atenolol, and also provides greater systolic and diastolic blood pressure reduction versus atenolol during the last 4 hours dosing interval. Bisoprolol also provides greater antihypertensive effect on both ambulatory blood pressure and office blood pressure compared to other agents such as losartan, amlodipine, and hydrochlorothiazide. Bisoprolol is also associated with stable heart rate reduction for 24 hours. A once-daily dose of bisoprolol is associated with the reduction of heart rate throughout the 24 hours dosage interval versus once-daily metoprolol. Bisoprolol is associated with better heart rate control versus metoprolol sustained release over 24 hours in hypertensive patients, and a stronger effect of heart rate reduction than carvedilol and nebivolol. Bisoprolol is different in safety profile. Beta 1 selectivity of bisoprolol results in minimal effects on blood glucose, lipids, triglycerides and cholesterol, peripheral circulation, male sexual function, and lung function in coronary patients with COPD. Bisoprolol shows a consistent pharmacokinetic profile with a balanced clearance between renal elimination and hepatic metabolism. So, who would benefit from bisoprolol? Bisoprolol would benefit different profiles of patients with hypertension that you see in your everyday practice. Patients like Mark, a hypertensive with concomitant dyslipidemia, Sarah, with hypertension with concomitant diabetes, and David, a smoker hypertensive. So, when looking for a beta blocker that offers beta 1 selectivity, efficacy, and safety, bisoprolol is different. The same origin, but different value.